Hi everyone, I hope you had a good week last week, and I just wanted to go over a few things from last week and this week, and then our quiz questions. I was hoping to be able to do a kind of a short lecture. I think I might transition to doing that each week, but unfortunately, the materials that I need to complete that I don't have currently. I've requested them, so I'm hopeful that they will show up shortly. But it took me, I'm going to say, probably 2 months to get a copy of the book. So I'm not feeling really good about these materials coming through quickly. But if not, maybe I would put up another short video. If you choose to watch it, great. If you don't want to watch it, that's fine. It would be optional. As opposed to this Ed puzzle, which is for points. Hopefully by next week, and again, it all depends on whether or not I can get access to needed materials. Maybe I will transition to doing more of a lecture at the beginning of the week instead of simply the Ed puzzle review at the end of the week, or for the prior week. I've got some feedback that might be helpful. So hopefully that would be. Otherwise, one thing I will mention, I'll probably mention this again when we get to the quiz. It's important to read the textbook. I just from looking at the quizzes, I kind of get the impression that maybe folks are just skimming it, or if you're reading it, you're not reading it like actually for content. Not taking notes, or not doing what you might need to do to kind of digest that information. So really, it's important to read the textbook and really dig into that info, and then also be able to answer questions based on it. I think I'd mentioned this last week, but the majority of the questions in this class are not just information regurgitated out of the text, but analysis type questions where you're expected to be able to examine the information you read and make a decision based on that. So reading the textbook, really important, and kind of digging into that information for the quizzes, obviously. So this past week, week 3, we talked about a few different things. One of the things that I think probably was most important out of the week was the conflict of interest discussion. Conflict of interest is something that we deal with in the healthcare setting. You deal with it with relationships between physicians and other providers, and hospital organizations, physicians and other providers, and other types of organizations like long-term care, etc., radiology practices, or independent radiology testing facilities, other types of independent testing facilities, any types of relationships, physicians with relationships to pharmaceutical companies and medical device companies. There's a lot of potential for conflict of interest, and we see it as a financial conflict of interest so that we're you know at at the risk of violating things like antitrust laws, Stark, anti-kickback, those types of things. But also, we can see conflict of interest issues related to research. So, you may have a physician who is doing a clinical trial for a specific drug, and oh, by the way, this physician's on the payroll for the pharmaceutical company that made it, and they're a consultant for them, and all these different things. That's a conflict. Sometimes conflicts can be resolved simply by disclosing them, but a lot of times that's not the case, and you need to try and avoid conflict. So you would need to divest yourself of that financial relationship with the organization, etc. So lots of different rules and requirements surrounding conflict of interest. And then there are also obviously some other things that we discussed last week. Ethical dealings with staff, ethical dealings with organizations, other organizations, outside entities, patients, families, etc. So that was generally our work for last week. For this week, week 4, and I do, I think I mentioned this in the announcement as well, but I apologize for being quiet last week. I was away. I think everyone knows that. I was in Orlando for the week, and between, we were at the park. So last week was my vacation. Unfortunately, as you guys know, we don't really get vacation teaching online or taking classes online. So that was my vacation, although I certainly did my best to work through it. But we were at the parks at Disney, believe it or not, even in the middle of a pandemic, and also looking for a house down there. So it was a busy week, and I apologize for. I certainly did my best to get back to everyone that contacted me as soon as possible, but probably wasn't as active in the classroom as normal. So I do apologize for that. But again, as always, if you have an issue, question, anything like that, always feel free to reach out, call, text, send me an email. And I'm happy to either meet up with you on Zoom or in the Blackboard classroom, collaborate, or just chat with you on the phone or email back and forth, whatever works best for you. You know that I'm here for you guys. So this week we're going to be talking about a few different things, all kind of rooted in the same ethical constructs that we've been talking about, but we're going to talk about ethics in marketing fairly briefly, ethics in managed care, resource allocation, and then also social responsibility. So things like a good demonstration of social responsibility in healthcare can be related back to, and I know we've talked about this in prior classes, and I think perhaps you've probably been inundated with it over the time of your time here in the program. I know we talk about it a lot in the undergraduate program, maybe not so much in the graduate program, but organizations like UPMC who have had their tax exempt status questioned because of potentially a lack of community benefit, closing a lot of facilities and organizations, practices, et cetera, in low-income areas, maybe not providing as much community benefit as would be expected by a tax-exempt organization, and very, very high executive salaries, into the billions. So it's well, maybe not billions, millions, many millions. I'm trying to think of what I just saw. I just saw that the salary of the CEO went up $8.9 million or something ridiculous like that. So I think once you get into those numbers, that is beyond my comprehension, and it all seems the numbers all seem to blend together. But so that's been taken into question, and I don't question the work of the executives at UPMC. It's obviously a great organization. It's where I received my health care. They have grown that from what it was many years ago to what it is now, with many facilities, et cetera. But there are questions. There are very specific elements that need to be met for tax exempt status, and that's been called into question from a pure legal standpoint. But let's think about it ethically as well. Would it be more appropriate for them to give back more to the area, to the community, especially the portions of the community in need, which we see a lot of, and they do. I'm sure there's some in the classroom that work for UPMC, and you see firsthand what they do to give back. And I know that employees themselves do a lot to give back and volunteer in the community and help to provide care to those that wouldn't have it otherwise. But there's just the notion of social responsibility and that giving back has been called into question in the past, and so much so that there was a lawsuit about it. So just think about those types of things. That's a good case study to examine that notion of social responsibility, and other aspects of that appear everywhere. And I don't mean to use to pick on UPMC but they're a very easy case study for a lot of the things that we discuss because of their size, and because of their structure, and because they're local here. So we can see what they do on a regular basis. So don't mean to pick on them. If we lived in New York, I'd probably pick New York Presbyterian. If we lived we lived out in California, I'd probably pick Kaiser Permanente. There's a lot of organizations that are easy to pick on with regard to these case studies. So no offense to UPMC. And hopefully none is taken by those of you that work there. So let's go over our quiz questions. What I did this week is actually wanted to show you the chapter the information came from. So I did pull that out of the textbook. Hopefully that's helpful to you. And if you don't understand the answer, you can go back and dig into it a little further. And then obviously always come back to me with any questions. So first question, one of the governing body's most important responsibilities is selecting and evaluating the CEO. That's really, they do a lot. The governing board does a lot of things. Could be, it could be a board of trustees, board of directors, whatever it happens to be, but that's the governing body. And they do a lot of different things, but really their key task, the key task of any governing body is to select and continually evaluate the CEO that they've chosen. So they wouldn't secure lenders. They don't evaluate subordinate managers. That's the job of the CEO. And they don't necessarily they're not specifically tasked with ensuring organizations' proprietary information is kept confidential, although that's something important that they can be involved in. But their most important responsibility is that job to select and evaluate the CEO. And that comes from Chapter 7 in our textbook. Negligence. So negligence has a very specific legal definition, and it's all about the departure from the standard of care. So that comes to us from Chapter 8 in the text. It's not necessarily about not caring, because you can care greatly, but be negligent in your work. So that's not it. It does involve harm to the patient, but that's not the definition of negligence. You have to show some injury in order to claim negligence, to claim malpractice. There has to be some injury. I'll talk more about that in a second. And then obviously D and E were not correct. So negligence is really kind of to go back to general tort law, and we're talking more here about the legal definition as opposed to ethical definitions. But under tort law, in order for negligence to be proven or to have occurred, there needs to be a duty to care. So think about a physician that performs a wrong side surgery. So there has to be a duty to care. And obviously, if they perform surgery, there is a duty to care for that patient that they're performing surgery on. There needs to be a deviation from or a departure from that care, from that standard of care. You need to have breached that duty in some way. So if you perform a wrong side surgery, you have breached that duty in some way. There needs to be an injury to the patient. So it could be a physical injury, like if you perform surgery, let's say it was an amputation, they're supposed to amputate the right arm and they amputated the left arm. That's obviously causing significant injury to that patient. They're now missing the incorrect arm, and they will likely have to go forward and have the other one amputated as well. So it's causing injury to the patient, but it doesn't always have to be a physical injury. It could be emotional injury, mental injury, financial injury. There needs to be some injury in some way to the patient. And then finally, there need to be damages of some sort. So, for example, in the case of the wrong side surgery, that patient's going to require, obviously they had the costs associated with the improper surgery, but then care following that, etc. So there needs to be some damages. There need to be an injury and damages caused, damages in some way that can be recovered. So those 4 things are required for negligence, but the actual negligence piece is really that departure from the standard of care. So you should have done surgery on the right side, but you didn't. You did it on the wrong side, and that's the departure from the standard of care. Malpractice requires all 4 of those elements. Negligence in the pure legal definition is just that departure from the standard of care, and that comes to us from Chapter 8 in the textbook. Whistleblowing. So whistleblowers are those people sometimes, and I don't recall off the top of my head if the textbook calls them this, but you'll see them called qui tam realtors. That's the actual terminology from the law, a qui tam lawsuit. And so what whistleblowers do they are someone that's has inside information about an organization, and has tried to make some attempt at fixing an issue. Let's say that I work at Hospital X. Maybe I'm the compliance officer, or maybe I'm the billing manager, and I see that there are issues related to fraudulent documentation in the record and fraudulent billing based on that. And I try and take some action. So let's say I'm the compliance officer. I go to my boss, who should be the CEO. I go to the CEO and I say, hey, I'm very concerned about this. We're committing fraud. We need to make change. Let's figure out how we make this change. And then we need to disclose our error to the government and pay back what we received inappropriately. CEO says, no, I'm happy with this going forward the way it is, and you need to keep your mouth shut, blah blah. Or maybe even they fire me. So in that case, our internal effort at reform failed, and that person has a moral obligation or feels a moral obligation to protect the public, patients, the government, etc. So then I would go forward and technically blow the whistle. So I would report to whomever it happens to be. Could be the Office of Inspector General, the Department of Justice, the State Department of Health, whatever it happens to be, and then hopefully that entity would take action against Hospital X. So our correct answer here is internal efforts at reform fail, and the manager feels morally obligated to protect the public and the patients. The one that others chose most frequently, the two that others chose most frequently, was the second answer: internal efforts at reform fail, and the governing body gets involved. That's not necessarily the case. The governing body would likely not get involved in those types of things. But if they did, maybe they would then take action. Remember, the governing body is the board of trustees, board of directors, etc. of the organization. So the governing body may very well get involved, but that's not a whistleblowing situation. Whistleblowing is when someone goes to the government or goes to the private payers and says, hey, we're defrauding you. That's a whistleblowing situation. The third one, the manager is laid off and discloses information learned through innuendo and rumor. That would not be the case. In order to file a whistleblowing lawsuit, which is what actually occurs when you are a whistleblower, you need to have facts. So you can't have heard through the grapevine that someone was faking the documentation. You need to have actual facts that was the case in order to move forward with that. Now, so why would someone, outside of a moral obligation, why would someone be a whistleblower? Because, likely if you're a whistleblower, number one, it's going to be in the news. Number two, you're probably unlikely to get a job elsewhere doing that same thing, compliance, billing, whatever, just because you're kind of seen as a risk, I guess. That maybe you're kind of a spy for the government or something like that. That's not the way it should be, but that is, I'm quite sure, the way it would be if you were a whistleblower. And to kind of account for that, whistleblowers that are successful in their lawsuits with the government get 10% of the settlement. So let's say it's a fraud and abuse related, billing related lawsuit. The government recovers $10 million. You get $1 million for your trouble in the process. So it can be very lucrative for whistleblowers, but it likely also means that your career is for the most part over in that area, unless you want to go into consulting or something like that on your own. But it does mean that likely your career in that world is at an end moving forward. So that's what whistleblowing is. Next question. What is the most common breach of HIPAA? So, there's multiple answers here. Our correct answer is discussions about a patient with someone not involved in the case, which was mentioned specifically in Chapter 8 as being the most common breach of HIPAA. Having been a privacy officer, I can tell you that is very much the most common breach of HIPAA. Now, that doesn't mean that these other items aren't HIPAA breaches. So leaving a patient's file open to read, leaving patient information accessible on a non-secure computer, people making, health professionals making remarks, derogatory or not, about a patient. Those would all potentially be HIPAA breaches. The first one is questionable depending on who they were making remarks to, but the most common breach, specifically noted in the textbook in Chapter 8, is discussions about a patient with someone not involved in the case. So just remember with regard to HIPAA that the HIPAA privacy regulations specifically, information that you receive via your work. So you're working on a case, maybe you work in IT or you work in billing or you're a clinician and you receive information about a patient through your work. That cannot be shared with people that are not involved in that work. And likewise, even if you work in an organization, that doesn't mean that you have access to all the patient's information that are there. You only have access to the minimum amount of information that you need to do your job. So you can't go and look in the EHR for information about your children's records or your own personal records or someone else's records. That would be inappropriate. You can appropriately access your electronic health record via the Medical Records Department and Release of Information. And if you have minor children, again, you can appropriately access that information via the Release of Information area. But simply surfing the EHR to gather information would be inappropriate. And certainly discussing that information with someone that's not involved in the case would be very inappropriate as well, and sadly happens quite often. Okay, so that's the end of that. Let's hop back to the classroom here quick. So this week we obviously have some reading. We have a couple of videos. We have our discussion with regard to resource allocation. And, I think that we're seeing that now. We're actually seeing some of the impact of that now with COVID and the resource allocation of PPE, ventilators, testing, all those types of things. So that's our discussion for this week. We also have a case study about Theranos. Theranos is a fascinating case. There's actually I think it's on Netflix. There's a Netflix documentary about Theranos and the woman that ran it. But really interesting case study. So hopefully you enjoy that. And if you find it really interesting, I would advise checking out that documentary. It's not terribly long, maybe a bit over an hour and a half tops, but really interesting situation. And then also the topic choice for the final project is due this week. So, you want to choose, our final project will be kind of a final paper on an ethical dilemma. So you want to choose a, sorry, Topgolf is texting me. They want me to come to Topgolf, I guess. So you'll choose a specific ethical dilemma. Then you'll choose a position of that dilemma to defend. And you want to defend that position, whatever it happens to be. You want to defend it using research, case examples, the types of ethical theory and principles that we've learned. That will be how you'll approach it. It's not going to simply be a 7-page opinion paper. This needs to be reasoned arguments. But then I also want you to kind of pick the devil's advocate side as well. So think about objections to your position. So let's say you are, I'll choose a really easy one. We'll look at abortion because there's certainly people on both sides of that debate. So I want you to choose your position and defend it, but then think about some of the objections to your position and how how that has been seen in the literature. So again, look at research and make some counter arguments to that particular situation. And then finally, the kind of the end piece is that I want you to think about how this ethical dilemma and the two positions that you've discussed impact practice or policy in your area. So if you're currently working, it could be your area, research, clinical care, etc. Or if you are a full-time student, or are you not working in healthcare at this time, think about where you want to work. So let's say, oh, I really want to work in compliance at UPMC. Or how would this ethical dilemma that you're discussing impact compliance at UPMC? So that's the paper. For now, all I want to know is your topic. So the paper will be due in week 7, but at this point, I just want to know your topic, and then I'll give you some feedback on it, so that you can have an idea of where you're at overall. So, and then quiz as usual. So that's all I've got. If you have any questions, again, feel free to reach out. Otherwise, watch your grade book. I'll get through all of the grading stuff over the next week. And again, any questions, let me know. Thanks.